Hello, today we're going to be doing an eye and ear assessment. I have Carmen here. She's going to be my patient today. Carmen, do you give me permission to show this for educational purposes?
Yes.
Okay, she gives me permission. She is over 18 and we're going to go ahead and start. I'm going to pretend that I'm walking out and I'm coming back in, and then we'll continue and I'll be explaining the procedure from that point. So I'm walking out. I'm gonna go ahead and walk back in. I'm gonna knock, 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 knock. I come in. I'm gonna go ahead and do my hand hygiene. In this occasion, I'm gonna be washing my hands. I've already washed my hands. I am not, at this point, I'm not going to apply any PP since I'm not gonna need it. I'm gonna go ahead and do the double verifier with Carmen. I'm gonna ask her for her name and date of birth. Can you please tell me your name and date of birth?
Yeah, Maria Saavedra, January 14, 1975.
Okay, good. Do you have any allergies?
No.
All right, so I'm gonna go ahead and provide privacy for her, and I'm going to explain the procedure. Today I'll be examining your eyes and ears. This will include checking your vision, movements, and your hearing. It shouldn't be painful, but let me know if you feel any discomfort, okay? All right, the equipment that I'm gonna need for today is a pin light, a Snellen chart, a near vision print, an ophthalmoscope, an orthoscope, and a tuning fork. I don't have a bunch of this, but we're gonna pretend that I do. So, okay, so now we're gonna go ahead and move on with the eye exam. I'm gonna be looking at your eyes overall. So right now, I'm inspecting your eyebrows, your eyelashes, your eyelids. I'm looking at them right now, and they are all looking symmetrical. The next thing that I'm going to do is I'm going to pull down slightly on your lower lids, and I'm going to have you look up. So I'm going to pull this down. I'm going to have you look up. And I am looking at the sclera, which is white, and the conjunctiva is shiny and pink. Good, Carmen, thank you. Next, I'm going to see how reflective the pupils are to light. Carmen, can you please stare off straight that way? I'm going to shine a light on each side of your eye. You just keep staring that way. I'm going to shine a light. I'm going to shine the light. Good. Now I'm going to do the other eye. Good. So, okay, so they are both they both constrict and are equal in size for accommodation. The next thing is that I'm going to check for your corneal light reflex. So I'm gonna have you stare at this pin light. Just follow it, okay? So, good. So, the next thing is that I'm going to check for the red reflex using the ophthalmoscope. I'm going to position the ophthalmoscope about 12 to 18 inches away from you. I will redirect the light source towards your eye and have you look towards the light. So now I'm going to shine the light on each eye. So I'm pretending that I'm shining the light on each eye simultaneously to check for symmetry of the reflex. Next thing that I'm going to do is check the extraocular movements with the 6 cardinals. So I need you to stare at this. Just follow the pin. Good, Carmen. So I'm checking at I checked your pupils, and they move. Okay, so I'm checking that your pupils move in a conjugate manner. That means they move together and watch the object, and that it's a normal finding. The next thing is that I'm going to do is, oh, and there's no stagmist or shaky eye motions. The next thing is that I'm going to do is the visual acuity using a Snellen chart that I have right here. I'm going to have you, so I'm gonna have you stand up, Carmen. I'm gonna have you stand up. We're gonna stand about 20 feet from the Snellen chart, and then if you can cover one eye, and I want you to read the smallest line on the chart.
D, E, F, P, O, T.
Okay, good. Now can you cover the other eye with one hand and read the smallest line?
D, E, F, P, O, T.
Good, Carmen. Go ahead and have a seat. Thank you so much. So, by doing that, you read, you read very good. Okay, so you read line 8 with both eyes, which means that you have a 20/20 vision. The next thing is that I'm going to do is the near vision, and this is a smaller chart that I'm going to have you do the same thing. I'm going to have you read the small print about 14 inches away, and I'm going to need you to cover one eye and then the other one. So let me get the chart. And we're gonna pretend that this is it. I want you to read the smallest line that you can see.
Okay. D, E, F, P, O, T.
Good. Cover one eye.
D, E, F, P, O, T.
All right, good. Now cover the other eye.
D, E, F, P, O, T.
Okay, good. So you were able to read well, so that's also a 20/20 vision. Thank you, Carmen. Now we're gonna move next with the ear inspection, the ear exam. I'm going to assess your ears. I'm just going to look at both of your pinna of the ears. So I'm making sure that your ears are proper location and symmetrical on the head. I'm looking in your auditory canal and external part of the ear to see for any wax. I do not see any. Then I'm going to palpate the pinna and the tragus, and let me know if you feel any discomfort, okay? Do you feel any discomfort with that?
No.
All right, so now I'm going to press on the tragus to see if there's any pain or if it looks good, okay? Okay, good. So the next thing is I'm going to pretend that I'm using an otoscope. I will inspect for external ear and surroundings of the structures, the pinna, the tragus, and the auricular area. I am now gonna look inside the ear or pretend I'm looking inside the ear, and will involve me pulling the back of the earlobe and and then inserting the otoscope into each ear. And let me know if you feel uncomfortable, okay? So I'm pretending like I'm gonna be looking inside the ear. Good. All right, good. I did not notice any abnormalities, which is good finding. Now I'm going to give you a simple hearing test. I'm going to speak 3 different numbers to each ear, and I want you to repeat them back to me when you hear them, okay? So, I'm gonna cover your ear and then I'm gonna say a number and you tell me what you hear, okay?
1, 2, 3.
Good. Now I'm gonna do the other ear. Over your ear.
1, 2, 3.
All right, good. So, you did well. So we know that cranial nerve number 8 is intact. Now we will move on to the Weber test. I'm going to place this tuning fork in the middle of your forehead, and let me know whether you hear it loudest in one ear, the other, or the middle. So I'm pretending that I'm hitting the tuning fork. And let me know where you hear it loudest.
In the middle.
Good. So, sounds heard equally in both ears. No lateralization. And then now we will be moving on to the last, which is the Riney test. You're going to hear the bus when I position the bus. Please tell me when the position is louder, okay? Either on A or B. So tell me if this is louder or the next move that I'm gonna make, okay? So
That's loud. That's loud.
okay. So air conduction is greater than bone conduction bilaterally, so that conducts our assessment. Thank you.